So I am Megan Claire Chase, but I'm also known in the cancer space as Warrior Megzy. Ultimately, once I did get the cancer call, I was diagnosed with stage 2A invasive lobular breast cancer. Well, now we know that that had really been growing in me for probably over from 8 to 10 years, and that it was missed on that mammogram due to the size of it. It was missed, and so I had 16 rounds of chemo. So I had the Red Devil, which is called adriamycin, and then I had the Cytoxin. I would have those together, be 1 week on, 1 week off. And then I had 4 of those, and then I had 12 of the Taxol, and then we had my surgeries, and I opted to go for a lobectomy. And then after that is when I had 33 rounds of radiation. And after radiation, and again, it was really horrific for me. After that, it was more healing time to heal from all of that. And then it was like 3 months later is when I would have my first set of scans post cancer. I was told by my oncologist that you might feel a little depression afterward because you won't be having, multiple appointments a week every week. And I was like, oh, okay. And I remember coming home after Camp Hope, and I was like, maybe like after that 3 months, it was like a little depression. Like, how about a lot of depression? How about the PTSD? Like, I started to get very angry, especially like, so my scans were clear that first 3 months. And that's like when I officially like really felt like I was a quote unquote survivor. And I even remember using that language of I'm a fighter, I beat cancer, and I was doing all of that, and everyone at work, because I was gone for that for about 6 weeks. That's about the only time I actually took for myself, really, for 6 weeks. And when I came back, they had my desk all set up and all this pink, and and again, I was loving it. And I distinctly remember when that shifted. It was like 6 months post cancer is when I really started to understand that this has impacted my quality of life. This has impacted my career because of my memory. And we were trying. Now the next step was to get on tamoxifen to help prevent recurrence. And I was supposed to be on that for 10 years because of the type of breast cancer I had with lobular and the fact that I was diagnosed under 40. They wanted to have me on it for 10 years to be, triple sure, right? Well, in between that time of scans and trying to take tamoxifen, this is when I started to learn how important it is to have people that look like me on clinical trials. And I used to be really against them because in the Black community, we talk a lot and we reference a lot about the Tuskegee Airmen and Henrietta Lacks. Like, we were told that by our grandparents. It's not even like that. It was that long ago. And so it was that moment when I started having like the rare side effects. And I'll never forget my oncologist. She goes, oh, well, just get off it and then and give yourself a break for 2 weeks and then get back on it. And I was like, what part of no are you not understanding? And so I was kind of taken aback that was her response. And so I was like, you know what? I turned into a chemist. I was like, let me try and find something that is still in that same family. And again, with tamoxifen, that's typically used if you had estrogen positive breast cancer, right? And so I found a Vista. I found like another one. I was like, oh, it's in the same family, because I'm thinking maybe there's an ingredient that I can tolerate better in that. That was like my line of thinking. So I come back and bring it to her. And I remember thinking, I'm not the one with the MD here, yet why am I the one coming up with other solutions? And ultimately, I did have the same reaction, but I was proud of myself for, again, advocating, because I was like, I'm highly aware that now I'm super sensitive to side effects. That's what I have discovered now. And that was never the case pre-cancer. And after that, and I had that same reaction, I told her, I said, you know what? I want to thank you for helping me get to this point. in survivorship. Thank you for keeping me alive, but I need to divorce you because you're no longer listening to me. And I need help in this post-cancer life, and I don't feel I can trust you for that. And she was like shocked. She was like, no one has ever said that to me. And I said, well, I have. And I said, yeah, and I mean, it was so, and my voice was shaking. I can say it with confidence here, but my voice was shaking. And though I've never been married or divorced, I was hurt. It hurt my heart. It took me like a good 2 years to like get over that because I felt like it was that moment where I felt like a number and where people only care about you when you have the cancer and they don't care about you once you're in that quote unquote survivorship stage and how it could impact your quality of life. Like no one told me that I might never get back to how I was pre-cancer and pre all of those crazy symptoms that I had. Like no one told me that. And I remember just feeling very betrayed. So I went to a competing cancer center. And again, I'm very grateful that I do live in a big city, so there are options. And I remember when that doctor, that oncologist, when he came in, this time I chose a man. I was like, I want to see the difference here. He walks in, and the first thing he said to me was, all right, Megan Claire, we need to think outside the box for you. And I actually started crying because I was like, I didn't, because I was all, my defenses were up. I was all prepared to have to be like, look, this is what needs to happen. But he came in, he was like, I read everything. You're very sensitive to side effects. We got to figure this out. And I was like, are you making me a partner in my own like healthcare? What? His name is Dr. Allen, and he's since retired, but I'll never forget that moment where I felt seen as not just a survivor, but struggling. He was very aware that I was still under 40. I had not had my birthday yet. And he was like, and he was aware that I was single and no children. And he goes, I really hate to do this. He goes, we're going to have to do Lupron injections. We need to suppress your ovaries because, again, the whole point of my cancer was that it was almost 100% estrogen positive and then progesterone positive. So we needed to like have as minimal amount of estrogen coming in as possible. And so I was like, okay. And those injections, like, I remember the first time having to go to the cancer center for the first injection. And it was that moment where I experienced PTSD. And I didn't know that was PTSD because I had to walk through the infusion room to get over to where I would ultimately get the Lupron injection. And then they had me like wait to see if I had, a reaction within that first 20 minutes. And I remember my heart's beating fast. I'm like sweating, my palm, and I was like, what is happening? And I didn't know that was PTSD, but I was getting so triggered by all of the beeping, because that's what people don't understand outside of cancer land, that if you're in an infusion room, not everyone gets their own room, and you're hearing all the beeps from the machines, and it haunts you, especially if you had a really tough time with chemo, which I did. And we did the Lupron injection, that first one. Again, I had such debilitating pain to the point I could not walk. And I remember like my mother had to actually call Dr. Allen at that time and say, she's in so much pain. She cannot walk. Like, she can't be on this. And instead of, and here's what I loved about him so much. He did not question it. He did not be like, well, just have her wait a little bit. He believed me. And I got to tell you, when a doctor actually believes what you are saying and knows that like this is legit, I could not walk. It was so it felt like some of us had experienced bone pain with certain chemos, right? And it's a horrific pain. It literally felt like someone had taken a sledgehammer specifically to my legs and just like broke my bones. Like that's the degree of the pain I was in. And so he's like, well, we can't have you on this then. And he goes, I was really hoping that your body could tolerate it. And he goes, you know what? He's like, let me think on this. You've got a break. Again, my scans were so clear. I wasn't going back until like another 3 months. And so when I came back in January, from the holidays, he goes, look, I talked with your gynecologist, who I actually loved. Like, I'd been with her forever. And he goes, and even if he's like, I always at least want you to have that option to be able to have children, but we really feel that your next step, and in order to take the other medications that would be best for your type of cancer to help prevent recurrence, we need to have a hysterectomy and an oophorectomy. And it really hit me. I was like, an oophorectomy? Like, I never heard that term before. I've always heard of hysterectomy, but the hysterectomy, that doesn't remove your ovaries. So that's why it's called a bilateral salpingo-oophorectomy, because it took out both sides, both ovaries. And I was like, at that time, I wasn't thinking emotionally. I wasn't thinking how that would affect me. I was just like, well, do what you need to do because I can't go through this again. Let's just do it. And then I remember thinking, okay, with all the money funneled into breast cancer, you mean to tell me the only other options is to push me into surgical menopause at least 20, years ahead of time? That's strange. And that bothered me. That's what I was like focusing on, was like, why are there more options? I don't understand. So ultimately, the day after Valentine's Day, I was like, huh, how appropriate. I'm back in the hospital. And that was my first time ever spending the night in the hospital, because when I had my breast cancer surgeries, it was the same day. Like, I mean, I was just so freaked out. But after that surgery, like literally, it was around 2 a.m. that they woke me up and had me already walking. They were like, we got to get you walking, see how you're doing. And I was just like, this is insane. Okay. Um, the difference with this type of surgery that I had, it was like robotically. And I remember the gynecologic oncologist, she was so tiny. She had like tiny little hands. So she actually had to get up on like a little stool, because it actually says that in my surgical notes that she was on a stool going all around. Um, but what was interesting, like, I think that's why I didn't understand how massive of a surgery that was, because my scars, I only have 5 tiny scars, and they were so small that I didn't think about just how massive of a surgery that was. I mean, it was taking out, my uterus, my cervix, my fallopian tubes, my ovaries, like all the things, right? I didn't think about that. And plus I still wasn't even a year post cancer. So I'm still healing from all of that too. In hindsight, I probably should have waited, but also we couldn't wait because we were so worried about the estrogen, and you just don't know. And you make the right decision for yourself with the information that you had at the time. That's something my therapist keeps telling me. He's like, don't get mad, don't should all over yourself. That's what he tells me. He was like, you made the best choice with the information you were given at that time. And I remember I had to take like a week off from work, and I was very panicked about that, because it's like, God, didn't I just get back to work and now I'm already taking, like, it was just a stressful time. And I remember there was a moment I was sitting in my living room and I was told, like, you can't pick up things, you got to be careful bending. And I literally felt my insides. It was so painful. Like they were shifting because now there was all this room. So they needed to like kind of shift to figure out where to go. And it was that moment where I got really nauseous. Like I have a lot of issues now with nausea. Like even the Zofran during chemo that I took couldn't touch it. And it's because somehow, I guess, like some of my colon or something, like something got messed up in there. And I was just ongoing nausea. And I remember thinking, God, I literally and figuratively feel empty. But no one told me how the insides would shift. And that was when I started to feel the back pain. And I remember thinking, I went in with no back pain. In fact, I went into that surgery. I had lost 65 pounds of the chemo weight. I was seeing my shape again. Because again, I used to be very fit and slim, but like strong slim, right? And I was so proud of myself coming out of that surgery. Now I'm in surgical menopause like that. The insides are shifting. And what was this back pain? And I did ask, I was like, I've got this weird back pain. Is that part of it? And they're like, oh, don't worry about that. You're just still healing. Like, you've got a lot of healing to do. But I remember distinctly knowing I didn't go in with that pain. And so again, I was ignored about the back pain. So then we try all the medications for post-menopausal women. Once again, I had rare side effects, and I had just gotten like my dream job at a major ad agency. I was so excited, but because all of this stuff is happening, you forget how it's also affecting your mind and the chemo brain going, under anesthesia multiple times within a span of a few months. I didn't realize the toll that that would take on me. And I was told by those two female bosses, they never told me that I had the option since I was new. I didn't know that I could take some time off. Like, I didn't know that. No one told me that. And they were like, you need to make a decision, choose your health or your work. You can't do both. And I remember thinking, well, I'm a cancer survivor now. That is not an option for me. And it got very dicey and very, I'm like, I could sue you for that. But it was that moment too where I was like, oh my God, I can't even handle the career that I used to thrive off of that stress, and deadlines. Like, I used to thrive off of that. And I was like, I can't do it anymore. And that was devastating. Ultimately, I have tried 6 different medications, both premenopausal and postmenopausal, severe reactions to all. And at this point, my dear Dr. Allen goes, and this is something I'll never forget too. He goes, Megan Claire, you're outside of my expertise. I don't know what else to do. So I want to send you to my colleague at another competing cancer center, because there are 3 here in Georgia. He's like, I want to send you there to my colleague because you're outside of my expertise. I've never met a patient where, they're just so sensitive to the side effects, and I don't want to keep causing you harm. I went to this oncologist, and she looked at me. She's like, I've read everything. I've read your chart. I've talked with both Dr. Allen and my previous active treatment oncologist. I was like, y'all did your homework. And she goes, look, and I don't know where she got this stat from either, but she goes, there is like about 25% of women where they cannot tolerate any of the medications to help prevent a recurrence, and they are on nothing. And I was like, at that time, I wish I had asked, like, what's your source for that? And also, how many of them were Black? Like, I really, like, now I want to know, like, the details of that. But at that time, I was just like, what do you mean I'm going to be on nothing? And she goes, look, she said, your body has been through so much trauma. And that's the first time I ever heard cancer and trauma in the same sentence. She's like, it's been through so much trauma. I hesitate to have you try anything else because of the severe reactions that your body has. And you have surgically done everything you can. And I think that should be our next course of action is you just continue to stay monitored, but you have surgically done everything you can right now. And I just left like in shock because you never hear that. Like, I'd never heard that. But it was also, again, hard financially because when you do that, like, yeah, you have FMLA that saves your seat at work, it protects your job, but you only get like a small portion of your salary. And then I had to pay for my insurance out of pocket. And so, I kind of, I had to take out a loan and, to keep myself afloat for 3 months, because ultimately I had to have yet another surgery in the same exact site where my cancer was, because I'd had fat necrosis, which can happen when you get a lumpectomy. And but it was palpable. You could feel it. And it was in the exact same location where my tumor was. And so my plastic surgeon, he was like, I know this is messing with your mind, but I promise you it's not the cancer. And so we wanted to see if, like, over time it might, I'd massage it every day, multiple times a day to see if it would go down, but it never did. I kept getting really, really ill starting in 2018, like so ill from trying the medications. And then, like, in a 3-month period, I ended up in the ER. They thought I was stroking out. And the fact that I kept getting so ill, I was like, something's going on. And so, luckily, insurance covered that 100%, that surgery. Again, multiple surgeries. Um, and we go in. We thought it was just going to be a simple surgery. He was going to go into the same in the scars and just like pluck it out, right? As usual, I have to be extra. It turned out not only did I have fat necrosis, but a hematoma had formed from the original lumpectomy, quadrantectomy, when they took the quadrant out, had attached to the fat necrosis and had formed a crystallized like ball. So instead of taking out like what we thought was like this big an egg, it was actually like the size of a small water balloon. And ever since you took that out, I haven't been ill like that since. But it turned out to be much more complex, much more painful than I thought it would. And I remember, like, after all that, again, I think I'm still in like some shock. And I said, so when are these scars going to disappear? Because I look like a railroad track. And I'll never forget, his name is Dr. Mackay, such a great, gentle plastic surgeon. He takes my hands and he goes, Megan Claire, you remember the movie Titanic? I was like, yeah. I was like, don't tell me I'm going to be like Rose. What's happening? And he goes, remember how big that iceberg was, how massive it was at the top? I said, yeah. He goes, I want you to think about below how massive it must be below. If you're seeing what it is up top, what it must be below. He goes, that was your cancer. That is this experience. There was so much that we had to take out, rearrange, reduce, multiple surgeries. He's like, these scars are forever. And it was like the first time, because I guess, you know, you can only process so much. But when you look at your chest, and I think a lot of people think, oh, lumpectomy, that's easy, because a lumpectomy with radiation is the equivalent of a mastectomy. You still look like a railroad track. And I just, when he said that, it was so clear to me just how intense all of this was. But I think saying that now, and that's why I'm bigger, you know, the weight gain because of all the menopause, but also my brain can't distinguish between am I hurting myself or not, because fibromyalgia is running all through me. It feels like a radiating burn. The back pain is in a very specific location every single moment of every single day. Then, you know, trying to work on like my neuropathy. Like it was just so many things. So when everything is flaring, I get headaches a lot. I'm exhausted. And I realized just how much pain, I didn't realize how much pain can take over your life until I got like that. Because with all of this stuff happening physically and my nervous system, I still have a job to do. I still have to work full time. Like I'm a creative and I naturally have a lot of energy. Like I wear myself out just being me, you know, like how does that happen? And so it's really hard and I have to focus and I, you know, it's like I got bills to pay. I got my cat, my son, Nathan Edgar, baby Nady, you know, like I gotta take care of him, make sure he's got his food. But I never feel like I get to rest. And it's like I want to travel. I want to like actually own my own home. But every time I have savings, I think to myself, no, don't spend it because something else might happen with your health and you might have to take off like work. And that makes me sad too, because I don't, it's like I am doing a bit more living and not just existing, but it's a lot of pressure on my shoulders when, you know, I can't really pursue my true dreams of what I really like ultimately want to do, which is, you know, be on stage 24/7, because I have to make sure I have money and insurance for my 10 million medications and other surgeries and other procedures that just go on and on and on. And you know, and I thank you for giving me a space and you know, and it's like this isn't going to happen to everyone, you know, and that's what I want to be clear about. It's like, I think patients would just like to know like the potential. So like if something does happen or we get some sort of side effect, then we can be like, okay, all right, other patients have said this in the past, okay, this is quote unquote normal, or this isn't normal. And who do you go to? Where do you go? And I just find that like a lot of conferences and things that I attend, they're always, every speaker starts out with, oh, and I think my family and my kids. And I was like, do you think about those who will never have that? Like I feel very left out being single. And I don't mean divorce and now single. I mean like being single. I don't date. I don't go out because I don't know how to not talk about this. I'm in pain all the time. I can't make like the small talk or put myself out there even emotionally for like rejection because I'm bigger now. I have that insecurity. Um, and it's just I think people really don't understand how hard it is. It's hard enough being in this country, being Black and being a woman. And then when you're diagnosed at a younger age, and then you have all of these issues and you're still trying to have a career, but you also need to, pay all the bills and then be prepared for other medical emergencies and always have insurance and having to do everything myself. It's a lot. So it's like, yes, I'm normally smiley or whatever, but it's through my writing that people really got to know me. And that's where I was able to get some of this out. But it's hard. But I mean, yeah, I'm still here, but I really wish I had my quality of life. It's exhausting, so make sure to give yourself breaks. Like, I get it, but also too, your quality of life matters. And I often say, like, cancer cannot take away the essence of you. God, I'm like really crying here. It can't take away the essence of you. So there's just a lot that weighs on a person like me, but you can push through it, but also extend yourself grace and be like, it's okay to take a break. It's not being selfish. It's okay to take some PTO and actually, like, I shut down. Like, I do not answer emails when I take PTO. It's like, that is my time. And I think that's what people need to realize too. Like, you've got to actually make yourself the priority, because without your health, you got nothing.